Welcome to Raaonline. I am Dr. Venkatakrishnan. We are going to discuss a system, respiratory system, an important case discussion. After the case is discussed, we will have various diagnosis and what is best fitting to the history and clinical examination we will finalize. This is a middle-aged male, moderately built, moderately nourished. General examination clubbing grade 2, pulse rate is normal, blood pressure, respiratory rate is minimally elevated, temperature is minimal elevation. Upper respiratory tract is very important in any respiratory disease. See, for the nasal cavity, any ulcerations in navicular polyps or deviated nasal septum, which all know, nothing special for this patient, and the oral cavity, no oral thrush or no tonsillar enlargement. Inspection. What is very important is trail sign is positive. Trail sign positive suggests unilateral lesion or contralateral lesion. Apical impulse is visualized in the left fifth intercostal space in the mid-clavicular line. When there is a fibrosis, trachea is deviated to the same side. If it is left side fibrosis, apex is also shifted up. That is why mediastinum shift and apex shift goes together. No signs of volume loss, no drooping of shoulders. Drooping, you always look from behind. The patient should be standing. No supraclavicular hollowing or crowding of ribs, nothing is seen. Chest movements reduced on the right side. Trail sign is positive on the left side, but movements are reduced on the right side. So, there is a pathology in the right side. So, any pathology which can push the trachea to the opposite side. That is the clue from inspection. No scars, sinuses, dilated veins over the chest. Especially when you suspect mediastinum shift, there can be some mass, or it could be pleural effusion or a pneumothorax. If it is SVC obstruction, you can have dilated veins over the chest. JVP is non-pulsatile. In palpation, you have a shift of the trachea, it is confirmed shift to the left side. Apex is normal, chest movements are reduced anterior and posterior on the right side. Total chest expansion is only 4 centimeters. Usually it is 2.5 inches, minimum should be 2 inches. 5 to 8 centimeters is the usual chest expansion. Right hemothorax is significantly decreased, left is 3 centimeters. No tenderness over the chest wall. This tenderness localized over the chest wall suggests empyema. No subcutaneous emphysema, no tactile fremitus or friction fremitus.